So today we're with Mr. Rijpma from Microsoft. Hello, sir.
Hi, how are you?
How was your day?
Good, good. Been a long day, a lot of travel.
So did you just arrive today?
You just arrived in from Bangkok this afternoon.
So not such a long travel time?
No, not too bad. Only an hour, so it was fast.
But the traffic in Yangon, is it good?
Bad.
Bad. Okay. So I won't keep you long.
Okay.
So I just have a few questions lined up for you today. So you can actually tell more about your function.
Sure.
Today. So Mr. Rijpma is actually the Senior Director of Health and Social Services for Asia.
Yeah, so a lot of the things that I do in my role and what our team does is work with healthcare organisations, hospitals, social services, public health, health insurers, to use technology to advance care and the delivery of healthcare. So a lot of the things that we focus on is working with companies innovating and building technology, and so we work with companies here in Myanmar who use our technology to build systems for hospitals specifically. But we also do a lot of things in the area of helping people work better together through effective collaboration and using communication tools and technologies to enable that to happen, getting and deriving better insight from clinical data and other data that the organisation might have and be able to turn that into insight so they can make better decisions. And the other thing that we're very focused on is trying to reduce the long-term cost of computing and the complexity of computing through investing heavily in building out the intelligent cloud for enabling new classes of applications, but also to significantly make it easier for people to use technology in an effective way.
So I would like to ask is, what in your opinion is the level of patient-centered care in hospitals in Asia or even in Myanmar right now?
Sure, I can't speak for Myanmar as I haven't been to a hospital here before, but one of the things that I think when I look at Asia and I look at the hospitals that we have here, I think we're actually doing an outstanding job in general on the focus on the patient. If you look at some of the hospitals in Singapore and Thailand and so forth, the care and focus on the patient is really at the forefront of what they're doing, and arguably the healthcare experiences I have had in Thailand or Singapore are really in sometimes head and shoulders above what the type of care I've received in other countries. So I think Asia's doing very well, and I think as good as we are at service culture, I think it shows in the way we deliver care as well.
That's very good news for those in Asian hospitals there. With that said, what do you think is the future of patient-centered care, being home care?
Right. I think when we look at healthcare at the moment and we look at the billions of people that we have around the world that don't get adequate or equitable access to care, we actually have a big problem. And I'm not convinced that just building hospitals and building more care facilities is the right approach for the long term. And so we have to think about how can we disrupt healthcare in new ways. What can we do in healthcare that will dramatically change how we can support someone at home, monitor them proactively, use technology to event and alarm situations that might need intervention, and really design a new kind of healthcare system using technology that can serve the billions of people that don't have adequate access to care today, but also push that care into communities that do have access to care, but deliver new models of care that make a big difference to the way we do things. Let me give you a couple of examples of this. We've just been doing some work with Dartmouth Hitchcock Hospital in the US, and they're rethinking the way that they monitor and engage with patients in their home. So we might discharge a patient, we put a band on them, and that band is constantly being monitored by the software at the hospital, and is managing events and processes and providing patient reminders to take drugs and so forth. And we can actually monitor that patient effectively in the home without having them necessarily to come in. And knowing that your drug reminders and the drugs have been taken and so forth, and you have an active engagement with them, I think we can improve things like medical adherence and drug adherence, but also just make the patient feel much more connected with their care team.
I think that also makes them feel safe, like they feel like they know what they're doing.
Yeah, exactly.
For now, what kind of training do you think hospitals should give their staff so that they are prepared for a different future?
Yeah, I think I think one of the key things that you have to do in healthcare is, in this particular world, is you have to get people very comfortable with technology. Healthcare is, as I often say, is 10 years behind other industries in the adoption of technology to improve the processes of care. And part of that is because the technology hasn't really been good enough. And the other part is a resistance to change the old ways of the way we've done things. And I think you have to get people passionate about technology. You have to build systems that where they really feel like they can make a difference for the patient. And so young people are coming from medical universities now, and they're iPads and Facebook, and they live that world. They come to your hospital and they want that technology. But for the older doctors and surgeons and nurses and so forth that have been there a long time, we have to find a way of enthusing them as well. And so I think, how do we get the young doctors to train the older ones, and how do the older ones teach the amazing things that they've learned to the younger ones? And I think hospitals can really build culture in an organisation to drive a willingness for adoption of innovation.
So it's in a sense like traditional and modern healthcare, in a sense, meeting?
Yeah, I think it is. I think we've got to get the young to inspire the old and the old to inspire the young. And technology education is one important piece of that, but of course that's not all and everything in healthcare.
Okay, so sir, thank you for your time today,
Cool.
sir. I think that's all the questions I have lined up for you today.
That's great.
I hope you enjoy your session and your other events here at HMA.
I'm sure I will. Thanks for your
Have
time.
a great day. So that's it for us today with Mr. Gabe Rijpma from Microsoft.